Namaste, myself Dr. S.P. Moosath. Many are asking about fatty liver and other liver disorders because nowadays it's very drastically increasing like anything. Why? Because everybody is going for a blood test and they will be coming up with some result like higher level of SGPT, higher level of SGOT, and many are having around 90% are having right now grade 1 fatty liver. Whenever you go for a scan, you will get a result like grade 1 fatty liver, grade 2 fatty liver, grade 3 and grade 4. So almost majority of the people are in grade 1, and doctors will be saying that grade 1 it's normal, go ahead, nothing to worry. But you should know why this happens and what is the role of a liver in your body. So then you will come to know what should be the remedy for the exact remedy. Giving medications or anything is secondary. So before that, you should know what is the function of a liver. The very first function is the filtration of our food that we take or the extraction of that. That filtration is the first one. Second one is the digestion. Third one is detoxification or metabolism. Fourth one is protein metabolism and storage of some minerals and other active components. So the very core fact of a liver is to have a filtration. So right now when we check any liver function test or any scan, if we get a result like a fatty liver grade 2 or grade 3 or grade 1 or the higher level of any readings, we think that our liver is having some damage. This is what everybody knows, but it's absolutely, as per my experience, most of the cases the liver may not be in damage. I will tell you one example. A kid or a student studying in 10th standard, they are having a certain syllabus to study. If you say the student to study the syllabus of an MBBS student or even a degree student along with the 10th standard syllabus, and we put an exam, whether the kid or the student will pass the exam, will not pass, because it is more than that kid has to study. So along with 10th standard syllabus, he has to study the other syllabus also, and the exam result will come like he has failed in the exam. Whether we will say that it's only because of the kid and he is not having intelligence he has failed, we will not say. The same thing, you just think of your liver. Your liver will be having some capacity, suppose the capacity to filter or detoxify certain amount of food or waste material in your body. Suppose it may be 50 kgs. 50 kgs your liver is able to filter it. If you put 100 kgs or 500 kgs of waste, whether the liver will be able to do that? So if you are putting like that, the blood report indicates like liver is having some issue. We are not thinking whether we are putting the exact amount of or the waste product. So you should go behind, or what was the before process that made the liver to cause this issue. I can say the metabolism in the stomach. So the very first thing is we should take the pure form of diet inside. What should be the pure form of diet? Second thing, that diet which you are taking, it is properly processed in the stomach. So the whatever the work that a stomach has to do, that has to be done first. If the digestion impairment, the metabolism impairment, the absorption impairment, the assimilation impairment, all those things, if any issues that a stomach has to do, if it is there, you have to rule out that. Then rest of the things has to be transferred to the liver. So the load for liver will be very less. Right now what we are seeing is the liver load will be very much, that will indicate the higher level of SGPT and SGOT. Whatever the liver can do, maximum liver will do, and liver will push that to the kidney, whatever is there. And within 2-3 years, when we check the kidney function test, even creatinine level, uric acid level, urea level, everything will be increased. That doesn't mean that your kidney is fault. Most of the cases I am seeing, but many cases kidney also may be in damage. But still, 95% of the cases presently that we are seeing is not absolutely because of the organ damage. It's absolutely because of the heavy load of work organ has to do. So If you don't take care of your digestion and other activities, within 1 or 2 years, your liver function will be deranged. If you are not taking care of that for further years, it will cause damage to the kidney. So better don't go for any kind of symptomatic relief or relief in the blood test. You find out your basic cause and treat accordingly. It's very simple and more effective than going to n number of medications. Just think. Namaste.